Just real quick, everybody, if you wanted to receive the newsletter and you haven't had a chance to do the sign up, we'll pass it around. Thank you.
So cool.
Okay, I don't have a presentation. I'm just going to cover some basic things that we're trying to do to move the program forward. I think we've had a productive meeting so far. I appreciate your questions. I know there's a lot of them. I will try to get to as many of them as I can. And so, as John's pretty much given you my history, our history of where we came from, but I have been in workers' comp my entire career, and I've been in this program for the majority of it now. And I do love it. It's a very important program, and I really care about it. And everybody on my staff in national office and all the people that work in the program really do care about it. And as you know, as was pointed out earlier, they do a lot of things for the claimants to try to get them paid, and they do go above and beyond. They work at the resource centers to get these people paid when they need to get paid when they're on their deathbed. And I've seen so many stories like that. We probably need to get more of them out. And you know, really, this program it's constantly challenging. It's constantly growing. We're constantly trying to do more and be more progressive. And yes, we have changes. There are some programs out there that, you know, you have your set of regs and they apply to everything, and it works. And in this program, it's not that way, and it's constantly, we find new things just because we have different kinds of claims that we've never seen before, and that's why we address them as we go. Dr. Dave?
Yeah, I wanted to address this to John, and it's not a part of the formal questions that were submitted, but it came up in John's presentation on the second page for toxicology, where you would poo-poo the value of material safety data sheets. And now, in my personal experience, that runs contrary to what we do. So it would be helpful to me, and probably to some of the other scientists and physicians, to understand some of the rationale, so that we can be more appropriately focused.
Okay, well, not to interject here, but, you know, data safety sheets are basically just saying, this is material you need to stay away from. It is not something that has been scientifically vetted to say, okay, your exposure to barium nitrate causes X illness. It's just there's a threat that this is a dangerous material that you need to stay away from.
Well,
and it can apply to a lot of different things.
Yeah, but John, with respect to you, you made the comment earlier that you're not a scientist.
Right.
And so I don't want to cross-examine you now. But
well, thank God.
But the issue really comes up. The origin of the MSDS was the right to know law, and that picks up in 1983. So there were issues associated with exposure to hazardous and toxic materials prior to that time which weren't addressed.
Right.
And anyway, because of the way the law is structured, just about every chemical product that's sold in this country has to have an MSDS and other supporting paperwork with it. And there actually is vetted toxicological data contained in the chemicals that are extremely hazardous. And oftentimes, what I do in my private practice is what we'll do is we'll get a narrative from the claimant, or it could be a client, on what they were doing, what the chemicals were in the workplace. And so then what I do on the validation side is get the MSDS, go right to the physical properties, go right to the toxicological data, and then begin to infer, begin to make decisions and do further research. Yeah, I know it's
I'll take questions afterwards. What I think, you know, the only point that John was trying to make there was that we can't have a claims examiner saying, this is going to tell me something about what this person was exposed to or what it was related to. Yeah, if we have a doctor telling us something different, then we'll take a look at that evidence. But those alone, in the evaluation of evidence for a claims examiner, who isn't a scientist, they will need backup from a physician telling them what that may mean.
Yeah, and it sounds like you're utilizing them in some way to paint a broader argument for or against a particular thing.
It points us in a direction.
Right. But what I was talking about is that, let's say you present a case for Alzheimer's disease, and you sent me 15 MDSs saying, here are all the toxins this person was exposed to. They were all hazardous based on this sheet. Well, that does not mean that those exposures that that person encountered causes Alzheimer's disease.
Well,
That was the point I was trying to make, is that just the presentation of those data sheets.
Right.
And I think with that, I think we could talk a little bit more after this
okay,
about
because
it.
it's a
But
piece of a much larger puzzle.
Right,
Well,
but
yeah,
it needs
exactly.
to be tied in by somebody, and what we're saying is we don't ask the claims examiners to try to make inferences based only on those sheets.
Except I'll cut off for just a minute. Except we've been denied by people who don't have the interest to deny when there are actual vetted documents that may basically tip the scales this way. And I'll leave it.
Okay.
Now,
Our
the
claims examiners
important
do.
thing is that if you provided a material safety data sheet to an individual, he was working with that material. It's clear evidence of the exposure of that individual to that material because you gave him the sheet.
The sheet is, anyway, I'm not going to debate the sheets right now. And I'm also going to say that our claims examiners are very qualified at what they do. They've been trained. They're not lawyers, they're not scientists, and they're not doctors, but they have been trained in the evaluation of medical evidence, and that is what they do. And medical evidence, factual evidence, that's why they're qualified to do what they do. That being
They
said,
can't establish a disease by looking at medical evidence?
they're not medical doctors. They need medical physicians to provide them with reports, to help them evaluate the evidence. That is why we rely on doctors to do that.
And that's the input. And so they're not making independent decisions, but they're making decisions based on the evidence that's come in from the
Correct.
experts.
Right, so,
Correct.
so you, Wayne, or whoever wants to present the argument,
Yeah.
you present it, but what I was trying to explain before, and what Rachel's trying to explain, is that, the claims examiners are interested in doing the best job that they can based on the evidence that they are presenting.
Correct.
You are convincing that claims examiner of your claim.
Yeah.
If you are making a claim that these material data safety sheets support your case in some way because of this, with this, and this, then by all means do it. What I'm just saying is that they have to convince me that the argument that you're making is rationalized
Gotcha.
and is based on some good scientific basis to say the relationship exists. My point is just that you can't just present something and say, this does it all.
Well, it's not a shotgun approach.
Right, and you've really got to make a justification for the argument you're making. You certainly can use them. Wayne can use them. You can use them, but it has to be part of a more integrated argument supported by whatever the evidence you've got, and at least that could be part of it, but it can't be the sole basis for your...
And that's understood.
Right.
Okay,
Let-
I'd like
let's
to
Rachel-
move on, please. All right, I just want to let you know, first of all, that we do have, in my program, we have a set of goals, a lot of sets of goals. We have what we call our operational plan, which is something that we put together in our division. We look at every single piece of the process. John outlined a little bit about the process. We look at the time it takes a person to review a case, the time it takes them to issue a decision, to issue initial development action, to make a payment, to do a final decision, to do a hearing. All of these little tiny steps, which there's a lot of them, we have incorporated into what we call our operational plan. That plan is disseminated throughout our district offices, to our FAB, and to our claims examiners. That a lot of those elements are incorporated into their standards. And the only reason I'm bringing this up is that it's because we're trying to make sure that we're moving things as quickly as we can, while also providing enough time for the evidence to be collected. We also have annual accountability reviews in all of our district offices and our FAB, which means we have a team of people from policy and from other offices who have been doing it for a long time or are familiar with the policy to look at other offices' work, to look at their recommended decisions, their final decisions, how they're developing a case, whether they develop the case properly. Now, does that mean we're going to catch every error? Absolutely not. It means that we're trying to get a picture of, is there an area where they really need some additional training? So that's one of the things that we've done for years. And we also have an operating plan, which is something that we report to the Deputy Secretary of Labor on a quarterly basis, basically telling him he's got priority goals that he wants us to be focusing on, and mostly it's related to timeliness. This year it's also going to be related to quality, and that's something that I go up and meet with the Deputy Secretary and my colleagues to talk about every quarter. We've done fairly well with those this last year, and actually pretty much throughout the years, because it's a big focus. That focus sometimes becomes a challenge for our claims examiners because they say, I have all these goals I need to make, and yet you're saying I really need to further develop this case. And so we try to balance that and say, I don't want to push them too hard, but at the same time, we've got claimants that, are at the end of their lives and they need their decisions, and so we try to keep all that into account. Now, one of the things we've also done in OWCP is we've created OWCP is the Office of Workers' Compensation Programs. It's our umbrella and agency. And as an agency, we all have workers' comp programs. And we've developed some strategic plans for 12 to 16 recently, a new plan, which basically incorporates payments, claims processing, how we disseminate policy, how we share policy, employee satisfaction, and outreach and customer satisfaction. So we have this survey that's online. It's not a really extensive survey, and I know a lot of people don't go online. But what we're going to be trying to do soon is send out little cards to people who do have access to online surveys once they've had a communication from us. So if you get a development letter, some of the claimants might get this little card saying, you've recently been contacted by us. Please let us know how we did. That's partly so that we know if we're really being responsive or not. It's a way for the claimants and the advocates to tell us what we're doing. And it is important to us, and we get some feedback from resource centers, but we need to hear from the claimants that are actually, and you guys who are actually using our services. We also are looking at recruitment and internal recruitment and training, making sure that we're providing training. This year we have a lot of training planned for our district offices in terms of we have health physics training, industrial hygiene training, but basically just explaining the basis for where, why the health physicists look at it this way or the IHs look at it this way, how to use SEM. John indicated he just went out and did decision writing training. We've been trying to get the recommended decisions to be a little bit more claimant-friendly. We've gotten feedback from many people over the years. It's really hard to get 500 employees to write something the exact same way, and they're not going to. But what we've been trying to get them to do lately is to tell a story of the case and to tell relevant facts about the case, not to repeat everything that they've already repeated before. In some cases, it's necessary to say this is when they filed, this is when this happened. But in other cases, if it's impairment or wage loss, they can really at that point focus on the decision that's being made at that time. So those are the things we're trying to work with our claims examiners on, because they want some template language too, so they can make their work go faster, but at the same time, that gets us into trouble. So he's been going out to the field and talking to them about what can we do better, how can we explain this in more layman's terms, how can we make this program that's so complicated a little bit less complicated.